Check, check. One, two. Good morning. I would like to call to order call back to order the Human Services Committee meeting for Tuesday, March 4th, 2025. At this point, I would make a public safety announcement. That is not the public safety notes. Do we have the public safety notes? Okay. We're not sitting in our usual positions, so we will work through that. In the interest of safety, I would ask you to note the location of and access to the exits in this hearing room. The two doors through which you entered the room are the emergency exits and are marked with exit signs. In an emergency, the two doors behind the legislators can also be used. In the event of an emergency, please walk quickly to the nearest exit. After exiting the room, go to your right and proceed to the main stairs or follow the exit signs to one of the fire stairs. Please quickly exit the building and follow any instructions from the Capitol Police. Do not delay and do not return unless and until you are advised that it is safe to do so. In the event of a lockdown announcement, please remain in the hearing room and stay away from the exit doors until an all clear announcement is heard. At this point, I would like to go up to number 2 on the agenda, remarks by the chairs. I will just say that we have a new member of this committee. We're very excited to have. Has it been? Oh, we have not. It's not been official yet, so we do not have a new member of this committee. But we are expecting a new member any minute now. So fingers crossed. We will wait patiently and see if one materializes. But I have a hunch. And with that, I will turn it over to my co-chair, Representative Gilchrist.
Just good morning, everyone, and ready to get started.
Representative Case. All right. Next on the agenda, number 3, bills for review. I will entertain a motion to JF. The first item on the agenda, Senate Bill number 1158, an act concerning the establishment of a Department of Aging. Is there a motion? Motion by Representative Johnson, second? Second by Representative Gilchrist. Any discussion? Representative Case.
Thank you, Mr. Chair. And reading through this and having some questions on it through the public hearing, and I just caution and concern why it's actually putting another commissioner in place, and given the economic times that we have right now, it's putting 2 departments instead of 1. Years ago, we combined the 2. I don't see as though it's feasible for us to do this at this time, so I will be a no.
Any other discussion? If not, the clerk will please call the roll.
A motion has been made and seconded to JF SB 1158. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan. Representative D'Amico.
Representative D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Representative Hughes. Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto. Representative Santiago.
Yes.
Representative Scott. Representative Shake. Representative Stewart.
No.
Representative Vale. Is there anyone that did not vote that is now present? Representative Comey. And Senator Marr.
Yes.
Thank you.
So at this time, we're going to hold the votes open. We do not know yet how long we'll hold the votes open, but we will hold the votes open, and we'll make an announcement in a little bit. Next on the agenda is Senate Bill number 1300, an act compensating spouses for state home care. I'll entertain a motion to draft this to the floor.
So moved. Seconded.
Motion by Representative Fortier, second by, was that Representative Hughes? Yeah. Is there discussion? Yes, Representative Mastro Francesco.
Thank you, Mr. Chairman. So I have a question on, I guess, line 68 through 73 in this bill. It talks about provides personal care assistance to be reimbursed when they're caring for spouses. Can you explain to me what the reimbursement process is and what that amount is to you?
I don't know the amount. It's possible that our researchers might know. I don't want to throw them under the bus on this one, but we do have a system in place currently for family members to be compensated for care. But right now, spouses are excluded from participation in this program. So this anticipates just allowing them to be eligible for the same reimbursement scheme that currently applies to other family members.
Thank you. And to you, do we know about how many people this will affect? How many, do we have an estimate of the number of spouses that are caring for their family to you?
I'm not sure if we received testimony on that. Certainly, we will find out through, if the bill comes forward, we'll get a fiscal note from the Office of Fiscal Analysis that will tell us that. Obviously, there's going to be a cost to doing this. The attempt is also to provide hopefully a much greater savings, because if you're able to support a spouse in providing care in the home, you're keeping someone out of a nursing home. So the hope is that this would actually save money the way it has worked very successfully for other family members.
Thank you. And I appreciate that. But I'm just looking at the language before me. It's helpful if we had the information is how many spouses does it affect? How many people? What could be the potential costs? And I guess potential costs, it would have to go through appropriations. Why we're not sending it to appropriations then? And the other question I have is, now it says a person who provides personal care assistance. So we have PCAs here that are unionized, correct? Should this pass and they are getting reimbursed for spouses, they are now under the umbrella of a personal care assistance, would they have to be unionized with them to you?
Yeah, I don't know the answer to that question. That's a good question. Representative Hughes, were you going to answer the question? Is that if
May I?
with the permission of the representative asking the question?
Absolutely.
I'll yield to Representative Hughes.
And I'm not the definitive, expert on this, but having worked in this program, so not every spouse is eligible because they're basically being the caregiver. And if they're frail themselves, that's not appropriate, right? So this is part of the home care program. And so they're not actually the PCA. That's a PCA waiver. That's a little bit different. This is a family home care. It's a stipend. Social work has to go in and really evaluate the situation and see if they are, appropriate, I suppose is the best way to say it. So it's somebody who would be needing a nursing home level of care, but they're being able to be supported with a nurse, by the way, who comes in and monitors that. So it's a different program than the PCA program a little bit. And currently it's caregivers, family members, but not spouses, largely because the spouses have been considered to be too frail. But that's not really fair to them because maybe they would be a good caregiver for their loved one and under this nursing supervision and so forth. So they get a stipend. They can't do another caregiving gig while they're doing this. And that's part of that fitness. So how many people it will affect? It depends because it's not a static thing, because a person who's a spouse might be appropriate for, 9 months, a year, 2 years, but not maybe forever. So
Thank you for that. So, but it doesn't really answer my question. Or maybe I just didn't understand it. A family member, not a spouse, who is taking care of maybe their mom or whatever, they fall under their personal care assistance, right? They get reimbursed. They get some sort of stipend or something.
They
I don't
get a
know
s-
if the
through
proper
UM
terminology is a stipend that
Yes, they get a
do get paid
stipend.
or paid through
It's
the
a
state.
stipend. It's not the same as PCAs who are getting an hourly wage.
Okay. But are the ones, the children that are home taking care of their spouses now, do they fall under the umbrella of a personal care assistance and that they would basically join a union?
I do not believe that is the case currently for the program that we're discussing. That is not the case.
Are we certain on that?
I'm not certain, but they're not PCAs. They're family members getting a stipend for caring for their loved one in their home.
So the children now that are through you, Mr. Chairman, I apologize for not going through the chair. The children right now that are caring for their family, for their mom or dad, are they under a program where they are unionized?
There are some, but that's a different program. That PCA waiver you're talking about.
If I could
yeah.
just jump in for,
Yeah,
maybe we could
sorry.
ask we have nonpartisan experts who we can sometimes phone a friend to if we're in just try to lifeline. Do we have, is this distinct from the PCA waiver program? Is this the same? Do we know? I don't think this is the same. But I don't think this is the same, but we want to get some clarity on that so we can answer Representative Master Francesco's question.
The bill applies to the Connecticut Home Care Program for Elders program, which is separate from the PCA waiver program. So the bill is making a change to the Connecticut Home Care Program for Elders.
Thank you for that answer. Does that answer your question, Representative?
That does. Thank you very much. Okay. So we don't know how many people it will affect. We certainly don't know the cost. But they did answer my question on that one piece there. So there's a lot missing here, so I'm not going to support this today. Thank you, Mr. Chairman.
Thank you, Representative. Any other comments? Yes, Representative Scott.
Thank you, Mr. Chair. The theoretical concept of this bill is something I definitely support. I do have one worry, and the worry is fraud, right? Is there any safeguards that are put in place here that potentially could protect against that fraud? You have a spouse who's taking care of their spouse, right? And there is a financial benefit of maybe extending that longer than it potentially needed to be. I just worry that it could be extended more time than they're getting paid when maybe the help isn't needed. And what kind of oversight, what kind of safeguards are there in place to to protect that from happening? I mean, it just seems very ripe for that potential happening.
Well, I think there are a number of safeguards in place. I recently had a meeting where I learned about the tens of thousands of hours of audits that the Department of Social Services has each year to safeguard state funds and federal funds. Additionally, we do have a Connecticut False Claims Act, which specifically empowers folks to come forward and report fraud, waste, abuse, specifically with regard to the Medicaid program. So if there is any of that happening, we want to know about it and make sure that we're addressing it quickly and thoroughly. I'll just point out, as I mentioned before, that this is an existing program. It's currently open to other family members. So presumably, if there's a lot of fraud happening, it would be happening could happen with an uncle or something, and not just with your spouse. I don't know a good reason why we would allow other types of family relationships, but have some sort of big prohibition on spousal support.
Yeah, thank you. I think there's a slight difference, and I do agree it's already open for kids to do it or whatever. But the idea is a lot of times they're married, filing jointly. It's literally their money within that household. So the money is staying with the household. A lot of times if an uncle's doing it, it's a different household. It's different situations, not necessarily the money that's staying within that specific household and how it could potentially benefit them. Again, I agree. It's maybe a nuance, but not necessarily a vast difference. But just wanted to call that out. So I appreciate the response though.
Representative Hughes for this. Oh, yes. Would you like to say something?
Again, through you, Mr. Chair, just having worked in the program, it must be administered through a third-party approved agency with all these protections and weekly visits and all this kind of stuff. So it's very heavily monitored. It's not like the state just, pays a stipend to the any of the caregivers. It has to be monitored very carefully through, like I say, nursing, social work, payee, a third party agency that is also the payee for that stipend and monitors that.
Any other comments or questions? If not, the clerk will please call the roll.
A motion has been made and seconded to JFSB 1300. Representative Gilchrist. Senator Lesser. Representative Case. Senator Harding. Representative Comey. Senator Mar.
Yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan. Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kit. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott. Yeah, Scott. Sorry. Representative Shake. Representative Stewart.
No.
Representative Vale. The roll call is now complete.
Thank you, Madam Clerk. Again, we're holding the votes open. Next, number 3 on the agenda, Senate Bill number 1301, an act concerning Medicaid rates for community hospitals and rural areas. I will entertain a motion to J after this to the floor.
Second.
Motion by Senator Mar, second by Representative Johnson. Is there discussion? Representative Master Francesco.
Thank you, Mr. Chairman. Would you be able to give me a list and tell me which hospitals this would be covered under? That would be covered?
Yes, I think I could certainly try off my best of my knowledge. I think Day Kimple in Putnam will qualify. Bristol Hospital, Griffin Hospital, Middlesex Hospital. I think Sharon Hospital would be a rural hospital. Is that not? No, is that?
Sharon is different.
What's that?
Sharon is rural.
So
So is Wyndham.
yeah, Wyndham is owned by a hospital chain. So I think we're looking. What's that?
The rural rate though.
The rural, so there's currently a federal designation for rural hospitals, and what we're also trying to do is establish a state designation for small hospitals that are separate from a chain.
Thank you. I just, there's nothing in here that tells me which hospital. So what designates a rural hospital, if you can explain that to you?
Well, there's a federal designation under federal law that designates what a rural hospital is, and they currently do get some consideration for that, and we're looking to increase that.
Thank you. I was just curious, what's the criteria to be determined, I guess, a rural hospital?
I don't know
Is it
I don't know the.
population? Is it,
I can speculate, Representative, but I don't know the answer to that.
okay. Thank you. I have no other questions.
Senator Harding.
Thank you, Mr. Chair. So to follow up on that same line of questioning, so particularly for my district, Sharon Hospital is in my district. I would certainly presume that it would be considered a rural hospital based upon the population in the area, et cetera, which obviously I'd like to see increased funding to there. But just the only problem is, depending on this definition, that they are owned by Nuvance, which is obviously a large conglomerate that owns a lot of hospitals. So I just want to make sure that how this bill is written wouldn't preclude a hospital like Sharon that's certainly most would consider rural being owned by a larger medical conglomerate.
I agree, Senator, with your concern, and want to make sure that we have that we would not preclude someone from getting that support.
With that understanding, then I would certainly like to see this move forward. Thank you, Mr. Chair.
Representative Johnson.
One other aspect of the rural hospital is the fact that there are actually no main highways to the hospital. So for example, I have no highway I have a highway, but it's a 2-lane highway. There's no 4-lane highways. Many hospitals that are not considered rural have the 4-lane highway access. So, and then of course the population, and as you said, Mr. Chair, it's the designation by the federal government as well. And they tend to move the districts around as well. They did about 7-8 years ago, move the district in my area to include part of Worcester. So they're not thinking about the state, but we are taking a look at the fact of how this is divided up because of the access and the population. So those are just a few of the things that I picked up along the way, but thank you for that.
Thank you,
the-
Representative. I've driven, as you know, to Willimantic on a number of occasions, and I've noticed the lack of highways connecting my community with your community.
Thank you for that.
Representative Gilchrist.
I'm glad to be recognized.
Thank you, Mr. Chair. It's come to my attention that the definition can be located on the Health Resources and Services Administration of the federal government, and they have a whole page that says how we define rural. Thank you.
Yeah, Representative Case.
Thank you, Mr. Chair. So how does this, because I know we talked about this a little bit during the public hearing, but will this can't supersede the contract that were in place now through 2026, is that correct?
Well, we can, my understanding, and I would be happy to defer to any experts on the rate settlement, is that we cannot reduce their funding below the amount specified in the settlement, but there's nothing precluding us from giving them additional funding. But I think you raise a good point, and it may be when we look at the fiscal note and we have a conversation, this may be something that we want to delay until after the expiration of the rate settlement. But there's nothing that would preclude. They're not going to say no to more money. But I think you raise a good question about the timing of the rate settlement and whether maybe we want to delay the implementation, to the second year of the biennium. I think that's a good question.
Because I do think if you talk to the hospital association, they're getting ready for another negotiation for a contract, and I think a contract's a contract. I think our executive branch would say that, we can't go higher or lower, but we'll let that be seen what it is, because the contract was formed and we need to stick by that, because we're trying to see how we can get 2 other hospitals into that contract, but it's not working. Thank you, sir.
Representative Vale.
Thank you. I guess my question kind of piggybacks that, but I'm not satisfied with the answer. So I represent a community that has about as rural a hospital as you can get in the state of Connecticut, Johnson Memorial Hospital. It was always considered, rural hospital, and then they became part of Trinity Health New England. So I know once they became part of that bigger group, they stopped getting some of the benefits that we've afforded through the state. So I'm not sure. I'm not a lawyer. I don't know. Lawyers tend to read things the way they want the outcome to be. But if I would like some clarity as to whether Johnson Memorial Hospital would be considered a rural hospital or if it wouldn't. I could go read something somewhere, but we have lawyers and we have research staff that I think someone should be able to get us an answer before I vote. Because I'll probably vote yes either way, but my concern is that Johnson Memorial, that does have some of the benefits of being that, also still has no major route in there. It's 20 minutes from I-91, and it services Stafford, Summers, Ellington, Union, Holland, and even some towns in Massachusetts. So it's an important part of our community. So I'd really like if someone could give me an answer before I vote on this, whether those type of hospitals are included in this. Thank you.
I will turn to I don't know if our legislative researchers have the answer to that question, but you do. You think?
Yeah, we can provide some information.
Okay.
So the bill says that it applies to hospitals that have been designated as rural by the Connecticut State Office of Rural Health. And they've designated 4 hospitals. So it's Charlotte, Hungerford, Day Kimball, Sharon, and Windham. It's Charlotte, Hungerford, Day Kimball, Sharon, and Windham.
Well, I had the wrong information, and I want to apologize to the members of the committee. It was certainly not my intent to mischaracterize the bill in any respect. We are we're hoping to work to get the list right, and part of that will be a fiscal question. But it's the intent to cover, I would say, those small hospitals, for that the Office of Legislative Research just described, but then also to figure out how to incorporate certain small facilities as well into that. Obviously, there's a bigger conversation of the overall hospital rates element. There's a lot of moving pieces right now, but it's our hope at a time of consolidation and a loss of services in much of the state to make sure that the state Medicaid program is doing what it can to support access to healthcare in all parts of the state, including in our rural communities. And so understanding that the budget right now is a work in progress, my request to members of the committee is that we get this out to allow the conversation to happen. But if there are specific concerns for hospitals in your districts, it's important that we know about it and we have that conversation and we do what we can to make sure that there's no loss of access. Representative Vale.
Thank you, and I appreciate the clarity. And again, I vote for bills as they are in front of me, not what they will become or what they weren't. I still am going to vote yes for this because I feel if it helps those 4 hospitals, that's great. But maybe if you're committed to at least have the conversation, maybe to include other hospitals that are in rural areas that don't qualify for this, to at least if we have that conversation, I'd appreciate it. Thank you.
Absolutely, Representative. Any other discussions, members of the, if not, the clerk will please call the roll.
A motion has been made and seconded to JFSB 1301. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case. Senator Hardin. Representative Comey. Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott. Representative Shake. Representative Stewart.
Yes.
Representative Vale. The roll call is now complete.
Thank you, Madam Clerk. Number 4 on the agenda, Senate Bill number 1299, an act concerning Medicaid covered dental care. I'd entertain a motion to JF to the floor. Motion by Representative Gilchrist, second by Representative Dathan. Is there discussion? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFSB 1299. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case. Senator Hardin. Representative Comey. Senator Marr. Senator Anwar. Senator Anwar.
Senator Anwar votes yes. Sorry.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco. Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott. Representative Shake. Representative Stewart.
Yes.
Representative Vale. And I would like to please remind members in the room to speak clearly into their turned on microphones when voting. Thank you.
Next, we have item number 5 on the agenda, House Bill number 6936, an act concerning funding for inpatient addiction treatment providers that cover room and board costs for Medicaid enrollees. Is there a motion to JF this to the floor? Motion-
Seconded.
Motion by Representative Gilchrist, second by Representative Hughes. Is there discussion? Yeah, Representative Master.
Thank you. Mr. Can you tell me what the difference is in this particular coverage? What is going to be different in this than what Medicaid already covers for substance abuse and inpatient treatment to you?
So right now, Medicaid covers the treatment, but they don't cover the room and board costs. And so as a result, it's really limiting the number of beds that could be made available. We did this bill last year and got a astoundingly low fiscal note. I think it was like $12,000 to cover it. Maybe it was $20,000. It was a very small fiscal note, but it makes a big difference for the nonprofits that are providing the care because they can't make the math work without the room and board costs.
Thank you. Last year, I believe when you did this bill, you mentioned that the fiscal note was only $12,000 and that is all it's going to cost to cover the.
What that we could double check what the note was. It was a very low note. And maybe Representative Case, do you remember? You're nodding with acknowledgement, so I want to see if you have the numbers offhand.
Last year we had this, and there was a company or a nonprofit that came forward, and I think you and I talked about this because it was a ridiculously note of like $12 a night at these small nonprofits. That's why the fiscal note was around $20,000. They are smaller nonprofits. They aren't the bigger recovery centers. But you and I both looked at that going, that was a low number, but it came both from the agency and out of the fiscal note. We voted it out last year and never made it out of approps. But
So this year, we're going to try to send it to the floor, and we'll have a conversation with our approach chairs to try to find that small amount of money because it's, there's a lot of folks out there who need substance abuse treatment, and the hope is that this will be the thing that will help those nonprofits provide that funding. That's Representative Dathan.
Thank you so much. Just for the point of clarity, I understand if things are less than $50,000, they don't need to go to approps. Is that right?
That maybe it was our mistake in terms of referring it last year. So we've learned from our lesson, and we will not be doing that this year. And we'll see what the new fiscal note says.
I'm so excited. Thank you so much.
Wish we'd listened to you last year. Any other discussion? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFHB 6936. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Yes.
Representative Shake. Representative Stewart.
Yes.
Representative Vale.
Yes.
The roll call is complete.
Okay, thank you. Number 6 on the agenda, House Bill number 6091, an act concerning an equitable Medicaid audit, billing, and reimbursement policy for pharmacies. I'd entertain a motion to JF this to the floor.
So moved.
Motion by Representative Hughes, seconded by Representative Gilchrist. Is there discussion? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFHB 6091. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Hughes votes yes.
Representative Johnson.
Yes.
Representative Kit. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Yes.
Representative Shake. Representative Stewart.
Yes.
And Representative Vale.
Yes.
The roll call is complete.
Okay, thank you. Next, we have item number 7 on the agenda, House Bill number 5730, an act concerning staggered terms for the members of the Two Generational Advisory Board. Is there a motion to JF this to the floor?
So moved.
Motion by Representative Hughes. Is there a second? Second by Senator Mar. Is there discussion? Seeing no discussion, the clerk will please call the roll.
A motion has been made and seconded to JFHB 5730. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey.
Representative Comey votes yes.
Senator Mar.
Senator Mar votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kit. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Yes.
Representative Shake. Representative Stewart.
Yes.
And Representative Vale.
Yes.
The roll call is complete.
Okay, thank you. Item number 8 on the agenda, House Bill number 5579, an act concerning the establishment of a Hispanic and Communities of Color Nonprofit Growth and Stabilization Fund. I'll entertain a motion to refer this to appropriations. Is there a motion? Motion-
Second.
Motion by Representative Dathan, second by Representative Hughes. Is there
Excuse me, Mr. Chair, the motion was changed to JF to the floor.
I didn't think so, but I will send it to yours. All right. Is there any discussion? The motion is a straight change of reference to appropriations. Is there, if there's seeing no discussion, the clerk will, is. No, that was the motion that was the motion that was properly made and seconded. So that we're just, if there's no discussion, the clerk will please call the roll.
A motion was made and seconded to refer to appropriations HB 5579. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Mar.
Senator Mar votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
No.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Okay, moving to number 9 on the agenda, an act concerning funding for nutrition assistance. I'll entertain a motion to JF this to the floor. Is there a motion? Motion by Representative
Second.
Dathan, second by Representative Hughes. Is there discussion? And I will just say this is this bill contains a substantial appropriation, so we'll obviously have to go to appropriations after it's referred to the floor. But we'll get a clarity from a fiscal note when it hits the floor. Seeing no discussion, the clerk will please call the roll. Oh, I'm sorry, Representative Matra. You looked like you wanted to say something, but you didn't raise your hand, so I wouldn't want to. Yeah, Representative Master Francesco.
Thank you, Mr. Chairman. Can you just kind of explain exactly what this bill does? Give us a little history about it and what it's going to accomplish to you.
Sure, thank you. That's a great question, Representative. So this bill it would appropriate $10 million to the Department of Social Services for nutrition assistance, specifying that 15% of those funds have to be reserved for products grown by Connecticut farmers. That would fund food share. It's my understanding that states around the country are stepping up and providing significant state funds to support nutrition assistance. Connecticut currently does not. I know the governor has a proposal to provide some funding in his budget, but this would be expanding that. Obviously, there's a bigger conversation about what the state's fiscal condition is and what we can support within the guardrails. The Appropriations Committee is really the best place to have that conversation, and we're not really able to talk about that, but we can talk about the need. We heard from farmers about this bill, and we heard from the nonprofit that's supporting all of our food pantries across the state.
Thank you for that. So I do believe this is important. It certainly affects our farmers. I'm certainly concerned about the funding for it. We're not going to send this to appropriations. I'm assuming in screening, it will just go to appropriations because this could be a significant dollar.
Of course.
So I will support it today to move it and then see what happens when the appropriation comes back. Thank you, Mr. Chairman.
Terrific. Thank you, Representative. Any other discussion? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFHB 7021. Representative Gilchrist. Senator Lesser.
Yes.
Yeah. Representative Case.
Yes.
Senator Harding. Representative Comey.
Yes.
Senator Mar.
Senator Mar votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler. Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Yes.
Representative Shake. Representative Stewart,
Yes.
Representative Vale.
Yes.
The roll call is complete.
Thank you. Next is number 10, House Bill number 7023, an act concerning Medicaid reimbursement for substance abuse coaches and mental health counselors under a peer support treatment model. And we is yes, I will entertain a motion to JF this to the floor. I will note we did get a substantial amount of testimony about this bill, about the need to lean in and engage the peer support community on the best way to provide the service. I think a lot of us found that testimony persuasive, and we'll be looking to incorporate those concerns as we look to implement this bill. And there should be a way to do both. And so it's my fervent hope that in order to have that conversation, we allow this bill to move forward and we keep working with the proponents to make sure that we get that right. And with that, are there any questions or comments from members of the committee?
We need a motion and second.
Oh, yes,
Chair.
we need a motion and second. Sorry about that.
moved.
A motion by Representative Senator Marr, second by Representative Johnson. Representative Dathan, do you have?
Thank you so much. As you had stated, there was quite a number of comments that came up in the public hearing. I know I've been working on this issue for a while, and I would love to continue to work on this. I have some suggestions on how we can get this working so that, one, our peer advocates and abuse coaches are able to be successful under any sort of model. So I am going to vote yes to move this forward today. Thank you so much, Mr. Chair.
Thank you, Representative. Other discussions? Representative Mastro Francesco.
Thank you, Mr. Chairman. Quick question. What is the difference in this particular program as to someone after treatment using Narcotics Anonymous, Alcohol Anonymous, and so forth? Do they not get that peer support in those programs to you, Mr. Chairman?
I think this is about opening up Medicaid as a funding stream for peer support work. There is currently peer support work happening in Connecticut. I don't believe, I think Representative Dathan has a better answer to that question. Representative Dathan.
Thank you. It's a very good question, Representative. And the sort of Alcohol Anonymous, Narcotics Anonymous are volunteer organizations, and they do not have the same sort of ability to have the same sort of certification that a peer support have, but they do act very similar. The peer support generally works in a whole recovery team, whether it's mental health issues or addiction issues. And so it's part of a team environment. And so that is why it's kind of like an overall healthcare goal, if you will, through you, Mr. Chair.
Thank you.
Thank you. Does that answer your question, Representative?
Yeah, I just one more thing. So the difference between, you had mentioned they have peers to help people with addiction and so forth. Those are more private organizations. This will be more state funded, where we will hire someone in different departments or around the state. Am I understanding that correctly, or no?
No. This would just allow peer support programs, counselors and substance abuse coaches to receive Medicaid reimbursement. Currently, they receive grant-funded support from the state through, I think, the Department of Mental Health and Addiction Services and maybe some other agencies. But this would provide, allow them the opportunity to build a Medicaid program.
Thank you. And do the ones that offer peer support coaching in the private sector, do they get grants, and are they covered through Medicaid to you?
No. Not currently. This would allow private sector substance abuse coaches and peer support counselors to build a service. Right now, they're not eligible to do that. So this would not entail the hiring of state employees. This would be about allowing private sector folks to bill the state for the Medicaid services.
Thank you. And but the private sector is currently, at this point, they are providing coaches and peer peer support to addiction treatment and alcohol treatment and substance abuse, based on what she had said before. It seems sufficient to me for that, but thank you. I don't have any further questions, but if you want to elaborate, if you can give me more information, it'd be helpful.
Representative Dathan.
So just to clarify, right now, peer support services are covered in an inpatient basis by a whole care team, different, and so that whole care team would include a variety and number of professionals, including a peer support. With that, this is basically saying that we can take those peer support services and do them on an outpatient basis. Some of these are done by nonprofits. Some of them are done by private providers. Some of them are, they're able to get insurance reimbursement for these services if you are a private paying. This just allows the same sort of aspect to be done through Medicaid. These peer support coaches are certified in peer support services, and there is a certification process. Through you, Mr. Chair.
Thank you, Representative. Are you all set? Okay. Representative Vale.
Thank you, Mr. Chair. This bill puts up a little bit of a red flag for me. When I look at the written testimony, and it's overwhelmingly opposed, and there's quite a bit of it. And I'm looking at where the testimony is coming from, and it's coming from the peer support specialists. So if they're opposed to this, why are we doing it? Would be my thing. You don't have to answer me, but that's what I don't understand why we're moving forward with something that so many people in this field are opposed to, and I don't see a lot of support from peer support specialists. For that reason, I will be voting no, and I would suggest others do as well. Let's listen to the people that actually do the work. Thank you.
Thank you, Representative. Is there a discussion? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFHB 7023. Representative Gilchrist. Senator Lesser.
Senator Lesser, aye.
Representative Case.
No.
Senator Harding. Representative Comey.
Yes.
Senator Marr.
Senator Marr votes yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Yes.
Representative Kitt. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
No.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Thank you, Madam Clerk. Moving on to number 11 on the agenda, House Bill 7026, an act concerning exceptions to the nursing home bed moratorium. I'll entertain a motion to JF this to the floor. Is
So
there a
moved.
motion?
Seconded.
Motion by Representative Johnson, second by Representative Hughes. Is there discussion? Yes, Representative Master Francesco.
Did you think it fails? Could you just kind of give me a little explanation exactly what are we trying to accomplish with this bill to you?
We're trying to build some more nursing homes, and we're trying to do it in a new system of greenhouse, much smaller sites that are non-traditional, focused on providing better patient care. We have had a moratorium in this state on new nursing homes for, I think, 30 years. And so we're looking at a small exception to see if these new type houses are able to provide better care for less money.
Thank you for that explanation. So we are trying to expand the nursing homes. Are you talking about new facilities, or are you talking about expanding the number of available beds in existing nursing homes to you?
This would be new beds to existing facilities, but a new type of structure, a new type of care delivery model.
Thank you for that. I'm just curious, just for clarification, obviously I like to expand our nursing homes. I think it's a good thing. There's a lot of people that maybe they don't want to stay at home and they need to be in a nursing home. And I remember, I believe it was last year, we passed a bill that only allowed nursing homes that they cannot have a room with 3 beds in it, and they believe it went down to 2 beds. So normally in a nursing home, so a percentage of those beds are reserved for patients that are on Medicaid. I don't know what the percentage is. Let's just say it's 75%. And the other 25% are available for people that are not on Medicaid. Maybe it's private pay. Does this affect that formula in any way to you, Mr. Chairman?
Not to my knowledge. Representative Johnson, though, has an answer. If with your permission, I'd like to yield to her.
Thank you.
Representative
Thank you,
Johnson.
Mr. Chair, and thank you, Representative. So one of the biggest problems we have is when people are admitted into the hospital and then they need to be discharged to a skilled nursing facility for treatment, follow-up treatment. It may not be for very long. It could be a couple weeks. Medicare pays for up to 100 days. But if they have to wait in the hospital, it's going to cost more money. So having access to a good discharge planning capacity is something that we have to take a look at now, because for 30 years we've cut back on nursing home beds, and to not have nursing home beds available in the catchment area for the hospital is a real problem. And to have people discharged outside the catchment area to a skilled nursing facility, what happens is it's harder for the family to get outside the catchment area to actually visit with that person. So you have that issue. You have a number of issues that, with respect to the certification of the hospital required by Medicare and Medicaid to be able to do an adequate discharge plan. And if they can't do it, then the person, like I just said, will end up staying in the hospital longer instead of going to the proper level of care. So this is another aspect of what this bill will do. And as we've been noticing lately, there are a number of senior citizens who are not able to move even from the nursing facility to even a lesser level of care as well. So it's making sure we take care of seniors. The bed reserves are for discharge planning, not necessarily for Medicaid, but to make sure that there's adequate discharge planning and capacity in the area to maintain the hospital certifications for both Medicare and Medicaid. So I hope that helps. Thanks.
Thank you. All of that's helpful, except I don't like the term lesser level of care. I prefer reduced level of care. Does that, so I will just also note that the department has, in their testimony, the Department of Social Services, in their testimony in support of this bill, has said that this is actually a tool they want in their tool chests, allowing these homes, but that they do not anticipate an immediate fiscal impact on the state. And so they think they can work around other changes in the nursing home industry to make sure that this is fiscally neutral to taxpayers.
Thank you, Mr. Chairman. And just to Representative Johnson, you had mentioned that the skilled nursing facilities do not have, the rooms or the beds are not available. Is it because when someone's coming out of the hospital and they need to go into skilled nursing, is it because of the discharge plan, or is it because the nurse or the skilled nursing facility or the nursing, they just don't have the beds available to you?
It's because of through Medicare. Yes, because they don't have beds. They don't have the beds in that catchment area. So each hospital has a catchment area for discharge plan, and so if they have to go outside the discharge plan to be able to maintain the level of care that they're supposed to have, then that is a problem. And that's something that we're looking at and seeing. I have hear from people in my district, for example, all the time. And, this is something that is really problematic. But back in the day when we didn't have these limitations, and for 30 years now we've had them, and it wasn't noticeable initially, but it is very noticeable now. So people need to be able to make the transition to a different level of care.
Thank you for that clarification. I don't have any further questions, Mr. Chairman. Thank you.
Thank you, Representative. Other discussion? If not, the clerk will please call the roll.
A motion has been made and seconded to JFHB 7026. Representative Gilchrist. Senator Lesser.
Senator Lesser, aye.
Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Mar, Senator Anwar, Representative Butler,
Representative Butler votes yes.
Representative Dathan,
Yes.
Representative D'Amico,
D'Amico votes yes.
Representative Fortier, Senator Gaston, Representative Hughes,
Hughes votes yes.
Representative Johnson,
Yes.
Representative Kit, Representative Master Francesco,
Yes.
Representative Meskers, Representative Pizzuto,
Yes.
Representative Santiago,
Yes.
Representative Scott,
Yes.
Representative Shake, Representative Stewart,
Yes.
Representative Vale.
Yes.
The roll call is complete.
Thank you, Madam Clerk. Number 12 on the agenda, Senate Bill 1358, an act concerning equitable compensation for state contracted nonprofit human services providers. We'll entertain a motion to JFS this to the floor, and I will describe the JFS language, which is as follows. It requires annual indexing of nonprofit provider Medicaid rates to increases in the consumer price index, and it strikes the underlying language regarding reporting. Is there discussion? Oh, yes, I do need him. Thank
So
you.
moved.
I am rusty this morning. Representative Hughes, seconded by Representative Dathan. Is there any discussion? Yes, Representative Master Francesco.
Thank you, Mr. Chairman. So this bill, the substitute language, I call it, like we do when we're in session, like a strike all, right? It's different than the original language. The language that is in here, did we have a public hearing on that to you, Mr. Chairman?
Well, we had the majority of the testimony that we received on this bill in the public hearing was on the concept of indexing. So there was a substantial conversation that happened in our public hearing about this concept. And what we heard from the nonprofit community was that as we look for ways to support their work, the best way for us to do so was with this language that we're doing. This is also, I will say, identical, I believe, to a bill that we heard in JF last year. We were not able to get it fully incorporated into the well, we didn't have a budget last year, but we're not able to get it fully incorporated, and so we're trying again.
Thank you.
Representative
Thank you. Again, I have concerns. I understand that, and I know how this building works, but to me, if the bill from last year, if that's what this becomes now, I don't know why that wasn't a bill did that bill from last year presented as a bill with that language this year, Mr. Chairman?
I am not sure the answer to that.
Okay.
I don't know if another committee is considering it. Certainly not in our committee.
Okay. So again, that's my concern. I'm not someone who tends to vote for placeholder bills, and I know that this one wasn't, but it's kind of in essence serving the same purpose, in my opinion, because it's the essence of what we're changing this bill to me, did not receive a public hearing. And for that reason, I'm not going to support the bill.
Okay. Clerk will please call. Oh, yes, Representative Cook.
Thank you. I was wondering if with this new proposed substitute language, we are including the birth to 3 folks in this because their testimony at the public hearing said that they were not included in it. And I don't know if it's because of how it was originally written, or I'm just wondering if you know the answer to that, Mr. Chair.
I am not sure I have the answer to that, but we can check with them to see if this language satisfies their needs. Certainly, our intent was to have a expansive definition of state contracted nonprofit human services providers. So we will endeavor to include them in this. We also, I will just say, there's also a separate conversation about birth to 3 rates that's happening, I think, in the Medicaid context. Okay. If there are no other discussions, the clerk will please call the roll.
A motion has been made and seconded to JFS SB 1358. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Marr. Senator Anwar. Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Hughes votes yes.
Representative Johnson. Representative Kitt. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
No.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Number 13 on the agenda. Senate Bill number 1122, an act requiring annual performance audits of Medicaid funded programs by the auditors of public accounts. I'll entertain a motion to JFS this to the floor. Motion by Representative Case, second by Representative Vale. Is there discussion? Yes, Representative Dave.
Thank you so much. I actually just came from a meeting with the auditors of public accounts, and I understood from them that they do. I had made the comment in the public hearing that we hadn't seen any audits from them for DSS for a while, and they assured me that we are expecting an audit very soon. But in terms of performance audits, which is one of the aspects of this bill, they do them periodically, also at the request of folks. So like Representative Abercrombie did a VAO performance audit a few years ago, and they were able to do that. In terms of the ability for them to staff this, they had estimated to me that it would be an additional 8 people that they would need to be able to fulfill this. And it might be something that we could think about, instead of doing a full performance audit, a limited procedure audit, which would incorporate some of the things and the goals of the chair. And I would hope that the chairs would like to work with me on this so that we can try to get something over the finish line for this, because I do believe that the intention to make sure that we have accountability on our Medicaid programs is super important and doing what it's supposed to be doing. But instead of maybe a full-blown performance audit, we do something on a limited procedure. So hopefully I can have that discussion with you.
You certainly can, and to look forward to working with you and your committee on figuring out how to do that right. And I appreciate the bipartisan enthusiasm about this issue. I think what I've learned in the testimony is just the scale of the audits that DSS is currently undergoing. But I think having some, particularly on the performance side of the ledger, having some legislative direction could help boost confidence, just to make sure that we're all sharing the same priorities and understanding how we can improve the delivery of public services. So if there's no more discussion, the clerk will please call the roll.
A motion has been made and seconded to JFS SB 1122. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case.
Yes.
Senator Harding. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Hughes votes yes.
Representative Johnson. Representative Kitt. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Yes.
Representative Shake. Representative Stewart.
Yes.
Representative Vale.
Yes.
The roll call is complete.
Thank you. Item number 14 on the agenda, Senate Bill number 985, an act concerning legislative approval for changes to the Husky Health Program reimbursement and care delivery model. I'll entertain a motion to JFS this to the floor. Motion by Representative Comey, second by Representative Hughes. I'll just say that the JFS language requires additional reporting from DSS to MAPOC on the financial performance of the Medicaid program and access to and quality of care for Medicaid members. Is there any discussion? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFS SB 985. Representative Gilchrist. Senator Lesser.
Yes.
Representative Case.
No.
Senator Harding. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Yes.
Representative Johnson. Representative Kitt. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
No.
Representative Santiago.
Yes.
Representative Scott.
No.
Representative Shake. Representative Stewart.
No.
Representative Vale.
No.
The roll call is complete.
Number 15 on the agenda, an act concerning legislative confirmation of the appointment of the Department of Social Services Medicaid Director. Is there a motion? Representative Hughes. Oh, you gave a thumbs up. I thought that was, oh, you were giving someone else a thumbs up, but you made a motion anyway. Thank you. Second by Representative Vale. I'll just say by point, I read with interest and heard with interest the testimony that the Department of Social Services submitted on this. They expressed the concern that the Medicaid director would become a political position if this were to go forward. It's not my intent to politicize that office. Obviously, that is an incredibly important office, one of the most important positions in state government, with oversight over $10 billion in annual spending and hundreds of thousands of lives. And of course, the welfare of providers and other folks who work in the healthcare space. Our only interest in advancing this bill is not to politicize it, but as we do with other critically important offices like the child advocate that also require specialists and with people with specialized knowledge and training, ensure that we're all rowing in the same direction, that an office of that importance has some thought and discussion prior to filling the position. I can understand why the current Medicaid director might take it a little personally and feel like this might be aimed at him, and I assure him and the department that it is not. But it is important that we have a conversation about where Medicaid is going when we're making a major personnel change. And so that's the intent behind it. And so would hope that we could have that conversation going forward. Representative Hughes, and then Representative Dathan, I see.
Oh, sorry. Thank you, Mr. Chair. Would that include, or could it be specified that that includes MAPOC, or is it straight up human services or, exec noms or something like that?
The bill currently does not include MAPOC, but I think that would be a consideration going forward. Representative Dathan?
Thank you very much. And when I joined MAPOC and Human Services back in 2019, we had a long-standing Medicaid director, Katie McAvoy, who was absolutely so wonderful that CMS has grabbed her. One of my concerns really is echoing what DSS said about having someone longstanding and knowledgeable in place. And I do not think that we should make sure that we politicize any sort of program like Medicaid, and that we are working towards getting the best and the brightest, no matter what political party or unaffiliateds that might be wanting to join. And so with that, I'm going to vote no today. I'm going to continue to listen to this, but I do have some more serious concerns about this, but I appreciate that you are open and you're listening to the conversation. Thank you very much.
Yes, thank you, Representative. And as I mentioned, there are across state government, there are different kinds of positions. There's certainly political positions. A state agency commissioner is a representative of the governor, and that is expected to be at least at some level of political appointment. And sometimes you see former legislators and other folks with a political background filling those roles. I don't think that would be appropriate to fill the state Medicaid director with someone with that background. But we have a different model of filling those more sensitive technical positions that still has additional oversight. And I would just point, as I mentioned before, to the example of the child advocate, which is a position that has a specific criteria. It's got a specific skill set that we recruit for. There's a panel that selects candidates for the position, recommends it to, I believe, the governor. There is a process by which those are filled that has additional oversight and confirmation, but it allows that conversation to happen about the direction, in the case of the child advocate, of child welfare, without saying we're going to put, some retired legislator in there whose only qualification is having political connections. And I think there's got to be a way to do both, where we have that conversation, but we don't put in unqualified people into positions of importance. Is there any more discussion? And anyway, I appreciate your willingness to work with us to try to figure out how to get this right. Is there any more discussion? If not, the clerk will please call the roll.
A motion has been made and seconded to JFSB 1360. Representative Gilchrist. Yes. Senator Lesser.
Yes.
Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
No.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier. Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt. Representative Master Francesco.
Yes.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
Yes.
Representative Shake. Representative Stewart.
Yes.
Representative Vale.
Yes.
The roll call is complete.
Okay, last and certainly not least, House Bill 6937, an act concerning Medicaid coverage for medically necessary children's diapers. I would entertain a motion to JF it to the floor.
Second.
Motion by Representative Gilchrist, second by Representative Hughes. Is there discussion? Representative Master Francesco.
Thank you, Mr. Chairman. This will be the last time I'll speak today. It's a good thing. Oh, in this committee. Thank you. Just a quick comment. Certainly, I clearly understand the need for diapers for children with medical conditions. The concern I always have about this bill is that we have a diaper bank that certainly supplies the need to all our families who need diapers. So that is my only concern. I think it's either one or the other, right? If they want to fund the diaper bank, maybe they change the process of funding. I don't know. It just seems a little redundant to me. And when I'm looking at the testimony from DSS, it looks like Medicaid already does provide, unless you can correct me, already does provide funding for diapers for medically necessary for incontinence and certain things. I'm assuming that this would expand it a little bit, but the diaper bank, again, would still provide diapers for these individuals. So is with caution, I'm going to oppose this today, see what happens when it comes out. Thank you, Mr. Chairman.
Thank you, Representative. Representative Case.
Thank you, Mr. Chair. And I will be supporting this today. Over the years, we have had in this committee bills like this. And I fought them in appropriations to try to help get them over the finish line, and we never got more money for the diaper bank. I think it goes back maybe 6 years, 7 years. And I think sitting on some of the hearings or some of the informational stuff with Representative Kilgrist, there is a need. There is a need to try to get diapers out there. Where it goes, I'm not sure. We haven't been able to get an increase for the diaper bank out of appropriations. Like I said, I've been here 13 years. I think it's been 6 years on the table. But I will support it today to try to work with my good chairwoman on the House side to see where we can get this to go. She's done a lot of work on this, and I just hope some others in another committee can see where this needs to be. So thank you, Mr. Chair.
Representative Gilchrist, we'll allow you to speak to them.
Thank you, Mr. Chair. Yeah, just want to say, been working on this for a few years, and the bill before us reflects feedback that we've heard from folks. So it really is tailored to medical necessity. And while the Department of Social Services does cover diapers, it's currently only for those over the age of 3. So this would be for under the age of 3. And what we do know from the diaper bank is that the need is so great in our state that my hope is with a proposal like this would actually cover some of those individuals who are from our lowest income backgrounds, loosening up room for others who have the need. So thank you so much, and thanks for those supporting.
Any other discussions? Seeing none, the clerk will please call the roll.
A motion has been made and seconded to JFHB 6937. Representative Gilchrist. Senator Lesser. Representative Case. Senator Harding. Representative Comey.
Yes.
Senator Marr. Senator Anwar.
Senator Anwar votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Dathan.
Yes.
Representative D'Amico.
D'Amico votes yes.
Representative Fortier.
Yes.
Senator Gaston. Representative Hughes.
Yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kitt. Representative Master Francesco.
No.
Representative Meskers. Representative Pizzuto.
Yes.
Representative Santiago.
Yes.
Representative Scott.
No.
Representative Shake. Representative Stewart.
Yes.
Representative Vale.
No.
The roll call is complete.
Okay, and can we hold votes till 3? Is that okay? Okay. We're gonna hold votes until 3 o'clock, and that's gonna be in Human Services and on Zoom. And with that, we'll recess the meeting momentarily, and we will be back for a public hearing on Thursday at what time? At 11 a.m. All right, thank you very much.
And the Bible
Hi, Brian.
for that.
Well, right.
And
That year is in Oregon, it's in California, I think it's in the New York one.
Can you hear me?
But
no, they don't have.
Hello, Senator Mar. You're muted.
I'm just worried I may have missed one vote.
Yes, you did, I believe. Let me double check which one that is.
It's a yes. Just wanted to-
Okay, I have you.
Okay, thank you so much. Thank you. Bye-bye.
Hi there.
Hi.
You can hear me, right?
Yes, I can hear you.
Okay. I believe I missed 11.
Okay.
Yes. 12. Yes. 13. Yes. 14. Yes. 15. Yes. And 16.
Okay, I have you.
All right. Thank you so much, Madam
Thank you.
Clerk. Bye.
Bye.
Hello, Representative.
Where are you physically?
I'm in Human Services, 2000.
In 2000. So if I'm looking at the escalators, you're to the left or to the right of the escalators? If I'm
You're on the
facing
second
escalator.
floor?
Yes.
Yeah, and
I'm
if
by
you're
the
looking,
escalators.
okay, so if you go towards the windows at the end of the atrium,
Yeah.
it's the door to the right.
So the window's behind the atrium. I'm going to go in there and see
Yeah,
about
so
my
if you're
roads.
facing the windows, it's the door to the right.
I can do that. You're the best.
Yeah, sure. Bye.
Yep.
Okay, all right, sir.
Stand up. That conversation.
Okay, thank you, sir. Thank you.
Mother of God. I'm on to. I went to 3 and back. So how many bills am I posting?
16.
Oh,
You could just save up.
no,
Yeah. Do you want to see the agenda or?
I'll meet something else. What?
Right under the wire.
No, please, I'm in the longest meeting on God's yes. And my new assistant is not on this game yet.
Are you in that joint commerce?
The commerce environment, yes,
Yeah.
yes. It's 10 or something? I know, I got here at 9 o'clock insurance.
Is it a hearing?
It's a public.
Joint public hearing?
It's a joint public hearing on the transfer act.
Okay.
Yeah. Yeah. Well, I think I should have called you. You're the best, right? It's so clueless. It's awful.
He needs to property.
I know you got a hearing and I was waiting to meet you for a very long time. My name is Rajiv Ahuja. Okay. I took a branch from Wally Farm.
Okay.
Last year. Yeah, town hall. I did like town holiday.
And again, by bringing him to.
And I did because I went home and I wanted to meet.
Where's your
you
phone?
So many times.
Okay.
Hold on, Rock. I'm gonna play back once. So. Yes, so, and I, was waiting to meet with you for a long time. I was gonna go to your Greenwich Democratic Party. I live in Greenwich on Locust
Where?
Street. You know, on Locust Street, Havemeyer, Greenwich Avenue.
Yeah,
Yeah.
so I am your state rep as well.
Good. It's,
I covered the post road to the water for all of that.
really, that's
Visit.
awesome. I love that area.
Let me
So,
see.
I was gonna invite you to the ICC Diwali Gala. So that's why I wanted to talk to you about that. Hello, how are you, sir?
Good, how are you?
Very nice to meet you.
Here.
How are you?
How are you?
Good.
How you been?
All right.
He's torturing me on Diwali. He's a constituent. Have to be an
Oh,
actor.
no. So that's why I was
Try a
trying to,
photo, right?
yeah, I want to take a photo right now. 'Cause I know you guys are voting.
Hit the yellow, hit the yellow, hit the
Yellow,
yellow, hit the yellow,
always.
and
Okay.
save the contact. That's all of me.
Okay.
Where you
all right.
And I'll try to do it.
Yeah, if you could co-sponsor the Diwali bill, that'd be too fine.
Send me what you want me to say. If a sponsor a Diwali bill,
I didn't
you want
tell
to,
you.
Diwali bill, or you want a citation?
Well, no, we already got the citation last. That's citation, right? I don't do the citation.
But for the town,
Well,
you want a state citation
Well, we're getting the state citation
from,
you, and so that's what I want to try to see how we can get this done.
I'll do it. No, call me and send me a text. Basically, what do I do? State the sites, the organization,
Right.
and then you give me 3 sentences, and I
I
get.
would like to co-sponsor the Diwali bill.
But the bill is, no, wait a minute.
There's a 10-29A bill and an HB
Somewhere.
5557 right here in this.
In the House bill? It's
Yeah,
in
the
it.
House bill.
Okay, I haven't even looked at it.
So I'll send.
Send that to me, I'll work on that. But what I'm asking you, is you have an event coming up?
Yeah, this year, October 21st, 2 to 5, 47.
You want a citation for that from the state of Connecticut. I didn't use it.
I appreciate it. That's what I was asking.
No, you asked me for the bill. I'm talking about a citation. We're
There's
thinking
there's
approximation.
two things happening. There's a bill that's happening right here.
Yeah, it's in there.
Yeah, so you answer that.
And if you want a citation from the state honoring the organization, or whatever, let me know.
Yeah,
We'll have that conversation.
Okay, thank you.
You're welcome. It should be in a meeting. Oh. I'm running around. You know where I am anymore.
So even if, House Bill 75 is passed, and I hope that it is, it will build in the blackout period because of the end. But if I, indicated in my, going with some citation, I would urge the amendment of House Bill 7085 to keep the working group active until the regs are effective. So
I think we can do it.
to the change being made in Senate Bill 1351 and 1401, which I will support, where the critical juncture is not the adoption of the regs, but the effective date of the regs. I think that needs to be the critical juncture for, monthly meetings of the working group through the effective date of the regs. And then the quarterly check-in process contemplated by 78.5 then kicks in once the regs are effective. So there's not this blackout period.
Thank you very much, Emily. Thanks for appearing before us. You did give us written testimony where you identified, gave us language specific. Okay, that's important. Questions, Representative Meskers?
Yeah, Emily, I'm trying to understand. I think the trigger now is the submission of regs. Deep is thinking that it may, or the approval of regs, thinks it may be delayed through this period anyway. The working group, I believe, was last year's bill, right? In terms of the working group we established. It goes back. So I don't know if in the interim, there's an amendment process that works for that before it comes to the assembly, which is what this bill does now. And so the bill creating the working group, we may need to amend for the effectiveness, but I mean, it passes both chambers and signed by the governor. So we're going to be relying on goodwill in the interim, assuming regulations get done, I think.
Fair enough, that even if House Bill 7085 is tweaked to encompass the change I'm suggesting, where the working group would be active until the effective date, there may be a blackout period where we're kind of, there may be, well, I won't say blackout period, a gray period where it's not statutorily mandated. But if it is clear that the working group activity will pick up again at the end of the session, I would hope that it continues uninterrupted.
I don't think we've had any objections in terms of, I haven't seen anybody objecting to that on the committees, but I think that's reasonable. We're talking about the two arguments, or the two discussions are about the regulations and about the statutes. And the last piece that I look at is very banal, which is, does this dog hunt? So everything function. So the cooperation and coordination as to how we issue the permits and get everything flowing through the system. I think we're all in agreement that we want to make sure there's an iterative back and forth, because the public needs to be able to go, well, it's like the new relatively good and newer DMV experience. Once you've built it, you want to make sure that it's working correctly. And so I think we've heard some very good comments from the LEPs. I'm I think I'm predisposed to tell you. I don't, I don't think any of us are against it, so thank you.
Thank you, Representative Mascaros. Questions and comments? Emily, thanks a lot and for all of your work here. Hang in there with us.
All right, thank you.
All right, thank you for, appreciate it. And I do not see anyone else signed up. Madam Clerk, is there someone I'm missing?
No.
Fantastic.
We've gone for the speaker order.
Thank you very much. And so, without further ado, I would.
Would anyone like an extra hour?
Graham, as we conclude this public hearing, thank you so much.
Perfect time.
Okay.
Oh, mother of God. Have a good one, everybody.
This turned out to be lots of longer than I thought.
I don't know whose fault that was.
Yesterday, this was
I
a piece of cake.
tried to-
Mr. said he wasn't gonna talk.
And the foolish thing is you believed it.
Yeah, he's very pointed about saying it doesn't have much fault to do.
Thursday to Friday, we'll hear back from them about it.
Yeah, we believe it. And I can tell you of breaks too, in Brooklyn.
Now we know. Thanks, everybody. Okay, so listen, so we have, so in session we have, maybe we want to. Thanks a lot. Stay in touch, okay? Yeah. Friday, do you want to screen on Friday?
How can I say no? You look at me with those eyes. I just melt. I just melt.
Okay. So,
We have leadership.
Oh, yeah.
Done. So you guys see how much why we care about it.
Yeah. Yeah.
So, like, wait.
do it like at 1.
Reading at 2:30.
Oh, so, okay.
Great.
Third.
Okay, 12:30.
12:30.
I gave you third grade. Was that after a test? They decided you could do third grade? They wouldn't take any higher? That's big this month. A couple other people. Yeah. I don't know why they don't ask me. I guess because the class is only 45 minutes.
Oh, like 4.
Four. They couldn't handle it with the line.
I said, how are you? Thank you. Thanks. Thank you.
Right?
So do you want to speak for a second? Because I didn't know what it was like yesterday.
What was it?
Yeah.
Yes, okay.
This is Democratic. Democratic.
So we know the governor broke his arm.
Yeah.
Was twisting it. It was. So
He said, be careful I don't break the other one up here.
one time long ago, when I had a really obnoxious, I stood on the lawn of the Capitol in a sling with crutches. And I said, no, everybody, well, quite frankly, it was about